Everyone. I'm Carol Ann Schwartz, the National President of Hadassah. It is with heavy hearts that we find ourselves here once again to talk about Israel in a time of war. As we all have experienced in our lifetimes, war anywhere in the world brings much sadness, worry, and confusion. And it really hits home when it involves our beloved homeland, Israel, as it does today. And today, we hope to shed some light on what Hadassah is doing to save lives, heal souls, and bring hope to the Israeli people during this war with Iran. It is now nearly 2 years since October the 7th, 2023. And while we remain traumatized by that day and everything that has happened since then, we find ourselves a bit desensitized, some of us, due to the war, because it has gone on and on. But this situation is very, very different from the previous missile attacks from Iran and the Houthis and Hezbollah. There is so much more destruction, several casualties, hundreds of injuries already experienced across Israel in just the last few days. I want to impress upon you that Hadassah stands prepared in wartime and in peace. It has always been part of our history as an organization, and today is no different. We're going to hear in this briefing about Hadassah and how we are prepared for this war with Iran, and also about the urgent need to ensure our hospitals and our youth villages can continue to do their critical work of healing while under assault. So, to start with a bit of context, on Monday, June the 16th, the Knesset extended Israel's nationwide state of emergency through the end of June. And in line with those directives from the Homefront Command and the Ministry of Health, Hadassah hospitals are operating in full emergency mode, which means, among other things, that non-urgent care has been paused, and those patients who were well enough to be discharged were Hadassah Hospital Mount Scopus and Hadassah Hospital Ein Kerem are prepared, as always, to treat mass casualties as needed. We are treating critical patients in our underground facilities with over 240 beds at both our Ein Kerem campus and our Mount Scopus campus. We have operating rooms situated on 4 floors underground that continue to function and, unfortunately, be busy. Essential units such as our NICU, pediatrics, surgery, and orthopedics are extremely active right now and protective underground areas. Our doctors, our nurses, our trauma teams, our entire staff are busy working around the clock. In short, our expert care at Hadassah hospitals continues uninterrupted. It's an incredible feat. And now, in regard to what's happening at Hadassah Meir Shfeyah and Hadassah Neurim youth villages, both villages have implemented crisis measures and have bomb shelters that have been upgraded and outfitted thanks to Hadassah support. And we are providing students, families, staff, safe havens for all at risk. Students who were unable to return to their homes have done so. Students who were able, to return to their homes have done so, while those who remain together are safe in our villages in comfortable and pleasant environment, made possible in part thanks to all of you and our generous donors around the world. And finally, Before I hand this over to Professor Yoram Weiss, our next speaker, let me say, as Hadassah stands with the people of Israel, we are profoundly grateful that you stand with us. We could not do this without you. We have always been there, supporting Israel, our homeland. We were there yesterday, we are there today, and we will be there tomorrow. And the urgency for donor support has never been so pressing. So I thank each of you for all that you do. It is now my honor, my privilege to introduce Professor Yoram Weiss in Jerusalem. Professor Weiss is our Director General of Hadassah Medical Organization. He'll share with us more about what it means for Hadassah to be in emergency mode, how our underground facilities are being utilized, as well as how the hospitals are adjusting for the absence of so many staff who have been called back up to surface. Yoram.
Anne, and thank you everybody for joining us. And I would like to start and say that first of all, we thank you for joining us and we thanking you for your support. And we're taking your support not as granted, and we appreciate each one of you. I have the sad news to share with you that Hadassah, over the years, since its creation, has been tied with the story of the State of Israel, but also with the tragedies that come with it. And we lost already about 39 people from our organization since the 7th of October. First line members of people of the organization, not actual workers at the organization, thanks God. I'm sad to share with you that 2 days ago, in the missile attack in Haifa, one of our workers has lost his brother in one of these attacks. You know, an organization is made not by infrastructure. It's made by the people that make it. I said it time and again. I said it during COVID. I said it during the beginning of immediately after the 7th of October, and I'm saying it now. We should be, or you should be, extremely proud of the people that make Hadassah, that make the Hadassah Medical Organization. The workers, the nurses, the physicians. We create an amazing organization. It has been amazing to see on the day that the current situation started, early morning on Friday. Basically, the entire hospital was at work without being called. People left their kids with their grandfathers and grandmothers, although their husbands were at war in Gaza or in the north, and they came to be part of preparing Hadassah to accept patients and to help us bring other patients to safety. People don't realize it, but a lot of the infrastructure in Israel currently and the medical services in Israel have been put on hold by a directive by the government. But some people cannot stop having their dialysis. So Hadassah in Kerem has absorbed all people that require dialysis, even in the community, to our hospitals, and we are operating shifts around the clock to provide these people with the life-saving treatment of dialysis. At the same time, we have taken measures to discharge as many people as we can, and believe me, this is not a simple task. We are sending people home, although that they are safe, but we know that maybe 1 or 2 days more in the hospital would be safer for them. But unfortunately, as mentioned by Caroline before, we have only 240 spaces that are available, and maybe a little more, around 300, that are really available in protected areas. We must understand that thanks to you, we have both in Ein Kerem and in Mount Scopus an amazing infrastructure. The Gandel Rehabilitation Center with its underground hospital which we put in place immediately after the 7th of October, thanks to donors like you, which provides an infrastructure for about 130 patients, and the amazing Davidson building, which provides us an extremely unbelievable infrastructure that allows us to continue to work in the most critical areas, in heart catheterization, in brain catheterization, and in surgery. The 13 operating rooms at -4 in Davidson are being used 24 hours a day, and the infrastructure to harbor patients in safety, both in -3 and -4. In -3 in Davidson, just to those who haven't been there, is a administrative floor that we have converted with the help of our workers into a real clinical area with patient beds and oxygen and all the necessary equipment and infrastructure. Thanks to you, we are able to provide these life-saving services for those who require it now in the Jerusalem area. And God forbid, we hope, we won't need to provide that to our wounded if a missile falls in the area of Jerusalem. I should say that until now we were really blessed because the Iron Dome is working. And when I'm saying Iron Dome, it's with all its layers, is making an amazing job. And although, unfortunately, there were some people who lost their lives, but the situation could have been much, 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 much worse. And I truly hope it won't happen. However, we are continuing at looking at how to increase the areas in the hospital that require to be completely in safe areas. And this time, we learned something new. The bombs that they send upon us, which are about 1 ton to 1.5, and actually it may even come to 2 tons, create an enormous blast injury. A blast injury that reminds us a little bit of the blast injuries we've seen in buses about 25 years ago when we treated people in the second Intifada. These blast injuries are really nasty. And this is the blast injuries that our friends in the Tel Aviv area have seen in some of the injured. But this has also ramifications for us. We learned very quickly that the infrastructure that we've put in place in the -4 and -3 operating rooms and the floor above in Davidson, which has also blast doors, is extremely important. We learned that the blast doors that we have in Mount Scopus at the Gandel Rehabilitation Center is extremely important. But we've learned also that there are areas that we need to increase their infrastructure and to add both protection and shielding on the windows, on the walls, and on the entrance. And this is where our really task goes in these days, to add areas in the hospital that are already blue with the previous conditions, but now can we convert them to really protective areas, even for a huge blast wave? And we're doing that. We're doing that in the medical intensive care, which is adjacent to the emergency room, which is fully protected also for blast injury and for blast. And we're doing that also with the general intensive care unit at the Davidson building. And we'll continue to do that because our job is to allow us to protect the best, to provide the best care while providing the best environment and protective environment, not only to our patients, but also to our staff. My responsibility as the Director General is to provide a safe working environment, even in these conditions, to our staff. For this reason, we have moved patients to -3 and to other protected areas, only those that cannot walk themselves. Any patient that can walk is being directed from his room into a safe area on the specific floors with the staff and goes into a safe room, which is with blast doors. To conclude, I want once more to thank you. Thank you for your support and looking forward to your continued support for us, to allow us to add more operating rooms at -4 and to allow us to add as quickly as possible additional protected areas in the buildings, both in the Mount Scopus Hospital and in Ein Kerem. Thank you very much. And at this point, I would like to proceed to Susie Patpen-Binisti, the Director General of Hadassah Office in Israel. Susie, please.
Thank you very much, Yoram. So it's a privilege to be here to be able to speak to you today and share with you a little bit about what we are going through in Israel right now as families, as workers. These are the people, we are the people who are serving Hadassah in Israel, who are serving the hospital, who are serving the villages. And I'm sad to tell you that today and in these past days, we are scared in a way that we haven't been before. Truly, the situation that we're going through is terrifying. Yoram spoke about the level of blast injuries that people are facing. This is what we are scared about on a daily basis. And we're learning every day more and more how dangerous and deadly these missiles are. I am sitting right now in the room that I've used since the beginning of the war, since October 7th, as our safe room. But it's not actually a safe room. It's the basement of our apartment. It has slightly thicker walls than normal. It has high windows, but a real safe room doesn't have windows like these. A real safe room has a blast-proof door, which we don't have. And on the first night that we experienced this attack here on Friday night, we brought all of our kids downstairs and we were here. We heard the sound of what was probably a defensive missile whooshing past our house. We live right by the Knesset. And my husband and I looked at each other and said, we probably can't stay here anymore. And the next night we went to our building's shelter. It's not a great place, a little bit not the most pleasant spot, filled with people and animals. Too many animals for us to bring our own dog. And when we went in there, my 7-year-old daughter, my youngest, was so terrified that she became sick to her stomach. And we had warned the kids that we weren't going to be able to stay in the safe room that they were used to anymore because it wasn't safe enough. But how do you explain to children that we're now in this situation where what we thought was safe, even in what was already a difficult situation, is no longer enough to keep them safe? The problem with the shelter that we have right across the hall here is that it doesn't have a blast-proof door. So we continued our journey. And on the third night, we moved to my sister-in-law's apartment, where she has a safe room. She has a mamad, and we stayed in there. The kids slept in there. And when we got the very terrifying early warning signal for the sirens, and then the 10-minute warning, and then the sirens actually started, we at least had a place to be where we knew that if a missile fell nearby, that we would, God willing, be okay. Unfortunately, there have been missiles that have fallen direct hits on people's safe rooms, and that hasn't been enough to enable them to survive. I want to tell you that we have staff, of course, all over the country. One of our staff members, who some of you may know, Lapid Levy, who is our CFO, lives in Tel Aviv. And a couple of nights ago, they had a missile fall just a couple of blocks from their apartment. It was a direct hit on the ground in Tel Aviv. They felt the entire room shake. They had particles coming off of their ceiling. They had the internal infrastructure of their ceiling that broke and fell apart from the strength of the blast. So and they have 4 young children. So just so you understand what we are going through as parents, as people who are trying to work and try to continue to ensure that Israel and Hadassah has all the support that it needs. We're doing this as we're living through really what I think is, for us at least, and I've lived in Israel for 15 years, but I've spoken to people who've been here their entire lives, including my husband. We've never experienced anything quite like this. Some of our staff members are on Miluim, are in reserve duty. I'll just tell you briefly about one of them, Eitan, who is on the search and rescue team with the Home Front Command, and he's based in Tel Aviv. And he's spent every day and night since this began going through the blast sites in Ramat Gan, in Bat Yam, working with the team, pulling people out, and making sure that the spaces are clear of people and safe. It is God's work. We're so proud of him. And he is one of many who are doing this, and one of many who are serving in Miluim and taking care of our people and our country in this very, very difficult time. I will just say a few words about what's going on in our villages right now. Carol Ann mentioned that we still have some of our students there. We have our families who work in the village, the staff who work in the village, and their families are there. And we in particular have the children who are international students from the Naale program, from Russia, from Ukraine, from other places in the world, who are not able to go home at this point. Thankfully, we have the shelters that Hadassah has supported the renovation of, and they have much, much better places to be in. As I understand it, the shelters are completely packed at the moment with children, the students themselves, with the families, the staff families, with pets. They're really filled to the brim. The students themselves and their families who are far away are very, very concerned and scared. One family even came to Taba on the border of Eilat, in Taba in Egypt, on the border of Eilat, to try to pick up their child from Hadassah Neurim. But the village did not have a way to safely send the child down there. So the child is still at the village, and the parents are on the other side of the border waiting to collect them. And at the same time as all this is going on, those kids are trying to keep going with their lives. They have their Bagrut matriculation exam next week that they're hoping to take. Meir Shfeyah was supposed to have graduation tonight. That, of course, has been canceled because we're limited to very, very small numbers of people in the same place. And so this war is coming at a time at the end of school year. So many children are missing the opportunity for closure in their lives, so many things that they've worked hard for that they have to put on hold. Now, of course, that is something that is small in the face of what's going on here and the giant tragedies that we have and the loss of life. And I'm so sorry to hear about the family, the brother of the staff member at HMO. This is really, I mean, these are the true tragedies that we're facing now in a much greater number. And even so, when we think about the children, when we think about all of us and the effect on mental health, we have to understand that the effect is great and will be felt for a very long time. So I want to thank you for the opportunity to share a little bit with you about what we're experiencing here. We are so grateful for your ongoing support and so grateful. We feel it from afar. We feel the hug from afar, and we thank you so much. And at this point, I would like to hand it back to Hadassah's National President, Carol Ann Schwartz.
Thank you so much, Susie, for sharing with us, and Yoram for sharing with us, and for being able to take this time to be part of this critical, important briefing. And we send our hugs, we send our love and our support to all of our colleagues in Israel. And Like I always like to say, this is our family. This is who we are. This is what we do. We thank all of you, the wonderful donors, for your steadfast support in this long road to getting past this horrible, horrible crisis. And we know this has been going on for over 600 days, but as Yoram shared and Susie shared, ever since last Thursday night, Friday morning, this has become intensified. This has become even worse. And as Susie shared how she has those windows in the door in her mamad, her safe room, which is technically not allowed now. My oldest lives in Israel, and I talk to him almost every single day, and especially since the bombing started and the attack started with Iran and Operation Rising Lion, I have asked him, are you in your safe room? Are you within 10 minutes? Because it's a true concern. What will happen? And as I sat in my office this morning, I have 4 windows in my office, and I looked around and I thought, oh my God, what if I were in Israel right now? And where would I go? What would I do? And what if this were occurring to me? And I know how it affects me when I think about it, and I cannot imagine the stress and the mental anguish that our Hadassah family is going through, and all of our family, all of the residents of Israel. And this is what we do, though. We make a difference. We heal lives. We heal souls. If someone said to you right now, you have 10 minutes to get to a safe room, it can have no windows, the door needs to lock securely, it needs to be so thick, where would you go? What would you do? We have to make sure our surgical centers are safe, that they're protected of adding these defense mechanisms. And sadly, Israel is once again fighting for its survival. We must keep people safe. We must take care of our family. And since our founding, Hadassah has been there for the people of Israel in good times and in bad. And we have responded swiftly to meet the urgent needs in the times of crisis. We were there yesterday. We are there today, and we will continue to be there tomorrow. And today, we find ourselves in that time again, and providing the level of safe and excellent care that you've heard about today from Yoram, from Susie. That takes preparedness, that takes speed, that takes planning, and that takes resources. And your support makes this life-saving work possible. Today, we're asking for your help to keep the people of Israel safe. Our urgent needs today include so many different areas: completing and equipping a sheltered surgical pavilion, supporting the specialized operating rooms for trauma and complex care, funding essential surgical equipment and strengthening the emergency readiness, trauma care, and mental health services that we are providing, and ensuring safe evacuation of dependent patients, providing that critical care that we are able to provide in our underground hospitals. And of utmost importance is protecting our at-risk youth at Hadassah's Youth Aliyah villages. And what we've also heard was some of the children who have gone home have requested they come back to us because they're safer. They know what we have to offer them and the shelters that we have built and we will expand. Your donation protects and saves lives when every second counts, every beat. Your gift, every gift, no matter how small or how large, it's essential to our ability to keep our patients, our students, our family, all of the staff safe. Please consider making a donation now by scanning the QR code on the screen or by visiting go.hadassah.org/Israel is at war. We need your help. We need your help more than ever. We do have major giving opportunities related to the crisis available, as you can imagine. Please contact Major Gifts at Hadassah.org. We have someone manning that email, waiting for your email. And if you have any follow-up questions, also email majorgifts at Hadassah.org. Our team members are ready to follow up with each of you to discuss how you can make an impact, you can make a difference today. I thank you for taking the time to be with us today. We will continue to keep you updated, to keep you posted as this phase of the war progresses, and hopefully it comes to a peaceful end quickly. B'chol lev, b'chol neshama, with all of my heart, with all of my soul, I thank you. Our thoughts, our hearts, our actions are with the people of Israel. We cannot do this without you. Thank you.